Hello, everyone. I hope everybody can hear me. Welcome to our webinar. It's 11 and we will start. Thank you so much for joining us today. And I hope you are all keeping well and safe as we are moving towards the winter. I am speaking here from the city of Guelph, and we had a lot of snow this weekend. So the landscape is quite different. My name is Karine Gagné, and I will be chairing today's webinar with Elijah Dalton. To give you more information about me, I am assistant professor in anthropology at the University of Guelph. I am also a member of the Circle Committee. So today's webinar is brought to us by Circle, which is the Canada-India Research Center for Learning and Engagement. Circle was established in February 2020 at the University of Guelph. Circle aims to be an interdisciplinary nucleus in Canada for cutting-edge research on India and Indian diaspora to showcase, advocate, catalyze, and foster an equitable, respectful, and sustained exchange of knowledge between Canadian and Indian scholars on complex and emerging and unexplored topics related to sustainability and social and economic well-being. With that being said, we would like to welcome you to today's webinar. We are very fortunate to have Elijah Dalton joining us and sharing his research with us. I would also like to introduce Elijah and all his work today. Elijah Dalton holds a BSc in agriculture and an MSc in capacity development and extension from the University of Guelph. He carried out his thesis research in Bihar, India, after being awarded the Shastri Research Student Fellowship. His research interests include agriculture, innovation, migration, and post-disaster recovery. Having grown up in Pakistan, Elijah can speak Urdu and is fascinated by the diversity and complexity of South Asia. He enjoys experiencing new modes of transportation, reading biographies, and learning from ordinary rural people. Thank you very much for joining us today, Elijah, and we are looking forward to hearing more about your research. So before we dive in, there are just a few logistical points for today's webinar. I will ask that you all keep your microphones on mute and turn off your videos so that we can establish a strong connection. Elijah will provide a presentation and we will have a question period after that. To ask a question, you can use the wave symbol at the bottom of your Zoom screen to show that you have a question. And at that point, I will call your name to give you the chance to ask the question. I also ask, also feel free to type your questions in the chat bar and I will ask them on your behalf during the question period. I also ask that we keep the timing in mind in terms of the questions and comments. So we would like to have as many as possible, and we have until 12:15 Eastern time today. So at this point, I will pass it over to Elijah. Thank you.
Yeah, thank you very much, Karine. And yeah, thanks to all of you for being here today and wanting to participate. And I also want to thank Dr. Sharda for inviting me to be presenting today. So let me just get up my slides here. There we are. So yeah, so in this presentation, I will briefly take you through the major points of my master's thesis, which is titled The Influence of Cash Transfers and Remittances on Children's Human Capital Accumulation. And I produced this thesis as a master's student in the Capacity Development and Extension program in the University of Guelph School of Environmental Design and Rural Development. And before we begin, I do want to acknowledge my excellent advisors, Dr. Helen Hambley and Dr. Ataharul Choudhury, as well as my host professor in India at IIT Patna, Dr. Aditya Raj. And I also want to mention my primary funding sources of funding, which are the Sastry Research Student Fellowship and the Queen Elizabeth II Graduate Scholarship in Science and Technology. Now, to start, I would like to define the key terms in my research title. So cash transfers are defined as non-contributory safety net programs that give cash grants to poor and vulnerable groups to satisfy basic consumption needs. Remittances are internal and international and intranational value transfers between resident and non-resident private actors. And last, human capital accumulation is a conceptualization of human knowledge and abilities as productive assets. The accumulation of human capital is seen as a critical pathway through which individuals move out of poverty. All right, with those definitions taken care of, here is an overview of what I will present today. First, I will introduce the problem, outlining the background, conceptual framework, objectives, and research questions. Second, I will describe what I did, explaining my methods and the choice of the case. And third, I will present what I learned by summarizing the findings, discussing their meaning, and sharing my conclusions and recommendations. Now, the problem that motivated my research is the increasing exposure of children to climate-related hazards. In 2015, UNICEF warned that 180 million children live in drought-prone zones, and 530 million children live in extremely high flood occurrence zones. The majority of these children live in the Indo-Gangetic plains of South Asia, as you can see in the map. Now, the literature is clear that disasters affect children differently than adults. Disasters can leave long-term effects on children's health, education, and protection. These effects can trap children in poverty by weakening the human capital assets that would help them succeed later in life. This point has been consistently raised by UNICEF in the wake of the COVID-19 pandemic. For example, see the recently published advocacy brief on averting the lost COVID generation. In response to the reality of children's vulnerability, many governments use cash transfer programs in an effort to sustain investment in children's human capital accumulation by providing cash to needy households and households recovering from disasters. Several studies have highlighted a need for better understandings of the pathways through which cash transfers influence children's outcomes, particularly in humanitarian settings. In the wake of COVID-19, many organizations, including the International Food Policy Research Institute, UNICEF, and the World Bank, have advocated the use of cash transfer programs by governments. In contrast to cash transfers, many disaster-affected households are known to mobilize remittances through family member migration. But there is a major debate in recent economic studies regarding the significance and influence of these transfers. Thus, the links between cash transfers, remittances, and children's human capital accumulation are poorly understood. Now, in order to understand and visualize these concepts, I proposed the conceptual framework pictured here. I developed this framework by applying the soft systems methodology of Peter Checkland as a sense-making model. This methodology looks at human actions as purposeful activities in response to a perceived problematic situation. So in my framework, the disaster is a problematic situation which affects the health, education, and protection of the child. In response, governments employ cash transfers while households use remittances in an effort to sustain investments in the child. Though this framework requires further evidence, I believe it is an effective interpretation of the current literature regarding the four bodies of knowledge which it interlinks. All right, so with this background, I set the objectives of my research both in relation to the research and in relation to the problem. So the objective in relation to the problem was to help improve children's chances of accumulating human capital by escaping poverty traps in disaster-prone contexts. The objective in relation to the research was to explore the relationship between value transfers and children's human capital accumulation in rural Indian households in a disaster-prone context. From this objective, I developed two research questions. First, how do cash transfers and remittances influence children's human capital accumulation in a disaster-prone context? I applied this question specifically to children's health, education, and protection. The second question was what opportunities exist for governments and NGOs to support and develop capacity for children's human capital accumulation? This question was a way of taking the findings of the first question and linking them back to the objective in relation to the problem by providing policy recommendations. I've already mentioned that I chose to focus the research on India, but here I'll explain how I chose the specific case of Madhepura District in Bihar. This purposeful decision was guided by the goal of exploring an extreme case. In this regard, India was a natural choice because it is home to the largest populations of children and is also highly prone to climate-related disasters. Additionally, cash transfer programs are a common government intervention in the country, and remittances are a major part of the economy. Bihar state is a particularly extreme case because it is highly flood-prone and has a high population of children. It has high levels of migration and remittance sending, and the current government is committed to development spending. Yet at the same time, Bihar lags behind other states on many development indicators. I also do want to acknowledge that Bihar is a very culturally significant state that was once the seat of pan-Indian empires, and today boasts a population of over 100 million people. Finally, Madhepura District was the central and by many metrics most devastated district in the 2008 Kosi floods. Following this disaster, focusing on this disaster and the years since it occurred, allowed me to have a long-term perspective of the influence of cash transfers and remittances on children. Health data from Madhepura District show high infant mortality rates, high rates of malnutrition, and very low literacy rates. Additionally, one study after the Kosi floods found extremely high rates of child trafficking in the region. These factors made Madhepura District in Bihar, India, an extreme case in which to explore the topic. I collected data using 4 methods. First, I conducted several informal meetings with experts and practitioners. Second, I held informational interviews with an accredited social health activist, 2 primary school teachers, and 1 NGO staff person. Third, I completed 52 survey interviews with participants belonging to community groups in 5 purposefully selected villages. Access to these participants was facilitated by working with a local NGO. Of the 52 survey interviews, 18 were conducted with females and 34 with males. This gender disparity occurred because few women in the communities felt educated or confident enough to participate. The majority of participants were farmers and farm laborers, and most participants were lower caste. Finally, I conducted in-depth interviews with 4 participants who were selected from among the survey interview participants. I used NVivo 12 software to code the data, and then applied soft systems methodology to construct logic models of the key themes. All right, so what did I find? I will briefly go over the findings of each data collection method. First, the informal meetings brought to light contextual factors such as gender and caste-based discrimination. Participants also discussed the high burden of disease, malnutrition, and medical expenses, which often result in high debt. Others argued that government programs are excluding the neediest. Regarding remittances, some participants highlighted the ills of distress migration. These meetings also helped to identify MKUY, or Mukhya Mantri Kanya Uttan Yojana, and Fasal Sahayata Yojana as 2 cash transfer programs in Bihar. MKUY is a cash transfer program for girl children intended to elevate their status, protect them, and support their education. Fasal Sahayata Yojana is a crop loss compensation transfer available to farmers. The informational interviews provided a more local perspective. First, they revealed that a cash compensation of around 2,000 rupees had been given out after the floods. This amount was equivalent to about 48 Canadian dollars at the time. This compensation constitutes another form of cash transfer, according to the definition that I used. On children's indicators, the participants said that most children got adequate nutrition and were attending school regularly. But when asked about the nutrition of low-caste Mahadalit children, one teacher said that they have their own way of life. Participants also said that child marriage and child trafficking had been reduced. The NGO staff person and one teacher pointed out that village child protection committees, or VCPCs, had made a big difference in this regard. They claimed that these groups helped people become aware of the dangers of trafficking and report traffickers to police. In relation to remittances, participants described migration as difficult but necessary for many households. They explained that there was no better option for most. Data from the survey interviews showed that most participants received between 2,000 and 2,500 rupees as compensation after the floods. They mainly reported using this compensation to purchase food and spend on household health. Several also mentioned purchasing supplies with this money. A large majority of the participants reported coping with financial need in the past year by taking a loan. Only 2 had received a cash transfer in the past year, and very few were aware of MKUY or had accessed it. Most participants said that someone in their household currently or formerly would migrate for work and send remittances. They primarily reported spending remittances on food, health, and schooling. When asked about children's indicators, most participants reported girls and boys receiving adequate food, attending school regularly, and doing some work at home. But some reported early marriages or children working outside the home. A few also reported that girl children did not get as much food as boys. Now, in the in-depth interviews proved to be particularly insightful. 2 women and 2 men participated. All were farmers and parents and belonged to the lower castes. 2 were involved as leaders in their community groups. 3 participants reported using the post-flood compensation for spending on food and health. But 1 participant described how she and her husband had used the money to start an ice cream selling business because they could no longer get work on the farm. All the participants described family members migrating for work, either recently or in the past. Often this migration was associated with debt and the need to pay off a money lender. In such cases, the majority of remittances would go to pay this debt, and children and women left behind would be made vulnerable to further exploitation. Participants described facing major barriers in accessing several cash transfers. These included time costs, discrimination, and lack of knowledge. 1 participant described the Cycle Yojana, which supports students to purchase a bicycle upon graduating 8th grade. She said that it was very helpful for supporting her children's school attendance and safety, but that her youngest daughter had been unable to access it because of caste-based discrimination at the local level. All participants mentioned getting Indira Awas Yojana, or IAY. This was a 55,000 rupee cash grant to support house reconstruction after the floods. Several said this grant was very helpful for avoiding debt and rebuilding their homes. Most of the participants said traditional loans from money lenders are very dangerous and likely to make children vulnerable. They clearly associated these loans with human trafficking. Participants discussed selling animals as a financial coping strategy, mainly saying that it was good to sell excess animals, but not productive livestock. All participants also reported that they now had bank accounts and indicated that these were helpful for keeping money safe and for increasing savings. So, based on these results, I constructed a logic model of the cash transfers that were encountered in the data. We saw that post-flood compensation had supported spending on food and health, and in 1 case, it had supported livelihood adaptation. IAY had also supported spending on health and helped families avoid debt. Fasal Sahayata Yojana, MKUY, and Cycle Yojana were partly or fully encountered as inaccessible by participants, who said that there were time costs and discriminatory barriers for accessing them. When it was accessed, though, Cycle Yojana did contribute to safer and more regular school attendance. So cash transfers can influence children's human capital accumulation, but we can see that marginalization works to create barriers for those who are often most in need of cash transfers. I followed the same strategy looking at remittances and concluded that the difference between safe migration and distress migration is critical, with the key deciding factor between these two being high interest loans. When migration is safe, it can provide support for children in a variety of ways. But when migration is unsafe, it increases children's vulnerability though it may weakly support spending on health and food consumption. Village child protection committees, as well as self-help groups, bank accounts, and the sale of excess livestock could support safer migration by helping households avoid high interest loans and the sale of productive assets. So my key conclusions from this study are that cash transfers influence children by supporting spending, avoidance of debt, and livelihood adaptation, but accessibility is a major challenge. The influence of remittances was shown to depend on whether they were preceded by safe or distressed migration. Based on these logic models and these findings, I identified 4 key opportunities for governments and NGOs. First, they could work to make cash transfers more accessible. This could include designing cash transfers with less conditions, providing more supports to help illiterate people access cash transfer programs, and working against caste-based discrimination. Second, I suggest using cash transfers to support livelihood adaptation after disasters. While further research is needed on this opportunity, this study suggests that cash transfers can support households in changing their occupation in order to sustain incomes after a disaster. And this is actually something that Dr. Craig Johnson has mentioned in one of his papers. And then third, I'd suggest building capacity for safe migration through governance groups like village child protection committees. These groups help increase the safety of migration by keeping records of people's movements and supporting them to avoid traffickers. Last, I recommend building capacity for low interest loans, bank accounts, and household savings. Access to financial institutions that can support these activities can help households avoid exploitation and cope in times of need. Oh, sorry. It is clear that the current crisis, Yeah, so I want to close out with some recommendations on the current COVID-19 crisis and some recommendations for further study. It is clear that the current crisis is causing a massive disaster for low-class migrants, especially in the early days of COVID-19. In this desperate context, we can definitely expect a rise in child trafficking and distress migration, especially as the pandemic continues onward. Local actors should work in capacity building with returned migrants and people who are in need in this time to increase economic and social resilience in their communities. This could include strengthening self-help groups and village child protection committees. Meanwhile, macro-level actors should continue providing emergency cash transfers as long as they are able in order to sustain households through this crisis. For future research, I recommend first, exploration of the barriers which marginalized people face in accessing conditional cash transfers, such as MKUY. The strict conditions on this cash transfer can be likened to an elevated highway, such as those that are common in Patna, the capital city of Bihar. Like an elevated highway, this cash transfer is very difficult for the marginalized to access, and there is a need to make this transfer more accessible through low barrier on-ramps into the program. Second, further research should explore the use of cash transfer programs for livelihood adaptation, like I just mentioned. And third, researchers should examine how high interest debt influences migration and how that links to distress migration. Fourth, future studies should explore the implementation and functioning of village child protection committees to further understand how they can contribute to children's well-being. There is very little literature at this point on community groups like this. And then finally, I want to recommend further research to test the conceptual framework that I proposed in this study. Thus far, it is just a rough sketch, and effective testing of its concepts was far beyond the scope of my research, and there's a lot to explore in that concept. So increasing knowledge in these areas has great potential to contribute to human capital accumulation of children in an increasingly crisis-affected global context. Thank you very much for your kind attention, and I look forward to listening to your questions. Thanks.
Thank you so much, Elijah. This was a really fantastic talk. Yes, so we are back to, okay. So I will take, we will now move into the question period. So just as a reminder, if you have any questions to ask, please feel free to wave or drop them in the chat bar. So, and there are like already really nice comments coming. So do we have, so I have a message here from Sharada. She has a question. So maybe we can start here. Sharada.
Thanks, Karine. Thanks, Elijah, for this presentation, for a nice overview. I mean, you talked, when you started your presentation, you mentioned that you were looking at the impact of cash transfers and remittances on children's human capital, particularly in, related to disasters, right? Mm-hmm. So I wanted you to talk a little bit about your findings in the context of disasters, right? Because maybe I missed it. I just got a sense that you were talking about the influence of cash transfers and remittances more generally, right, rather than in the context of disasters. If you could speak a little bit to that, it would be useful. Thank you.
Sure, yeah. I guess I would, first of all, I would say, so there's two cash transfers that we encountered that were given in response to the disaster. So that would be the first cash compensation, just a very small amount of money, and then the larger amount that was for house reconstruction. And so those, the really interesting thing that we found with that first small amount was that one participant in the in-depth interviews who described how they had been able to use that small amount of money to actually transfer what they were doing as a livelihood strategy and to start selling ice cream, which is really, really fascinating. And I think it's something that bears a lot more exploration, how cash transfer after a disaster like that can support livelihood adaptation in the short term. And then the larger amount for the housing, I think that showed up in the data that it proved to be useful and help people stay out of debt in order to rebuild their homes. But I think we do definitely see that in a disaster context, and in this context in Bihar, the cash transfer is a short-term solution because there's a lot of reoccurring flooding and a lot of reoccurring needs that occur in this part of Bihar. And so the cash transfer doesn't solve those problems with the kind of infrastructure that's needed. And so there's a whole nother aspect of that. Yeah, does that answer your question?
Yes, it does. Thank you.
Yeah, thank you. Thanks for asking. That's glad you
Thank
mentioned
you.
that.
Thank you, Elijah. I see that we have a question in the chat here. Helen is writing, just to be clear, could you tell us if the government of India's COVID-19 policies have inserted more financial resources into the existing cash transfer programs?
I actually haven't been able to follow this super closely, so I don't know. Actually, Dr. Sharda would probably have a more up-to-date answer on this, but I believe they have started some initiatives directed to COVID-19 that are cash transfer based.
Thank you, Elijah. Do we have more questions? I have some questions if nothing is coming. Maybe I can start with that. I would like to ask Elijah, you're talking about this, so you have these two categories, right? Safe migration and distress migration. I'm curious about how are they relating to migration inside the country and international migration? Do you see like some pattern emerging here, or what are your thoughts on that?
Between international and inside the country migration?
Yeah, are you able to associate safe migration as something which is more related to migration for work in other countries, or it's the things that you've been observing are all like migration to other parts of India, or like do you have a pattern in terms of like how these things are going?
Within this case study, it was almost entirely migration within India because of the low economic status of people, and so that was all they could afford to do. But I think that from what I've read about international migration as well, it's the same issue is the issue of debt. And so when there's that leverage on someone and they're under this heavy burden of debt, and that's part of the transaction that happens for the migration, it becomes much more difficult for them to actually use their income in a way that helps their family back home, because they're just working to pay off that debt and and they're kind of in an exploited situation where they don't have the control of where they're working and what they're doing and how they're money is being transferred back home and things like that. So it's really a lack of control that they end up having because of that debt.
Yeah, thank you for that. Since there is no other question at the moment, I will ask.
I have a question,
Karine.
Karine.
Okay, please go ahead.
So Elijah, just to take the conversation forward, I mean, you worked on cash transfers, and I was a little surprised that I didn't hear any reference to debates around universal basic incomes, right? Especially during the early days of the COVID pandemic in India, there's raging debates about the need for a basic income grant for poor families. So, so I would like to hear your thoughts on, cash transfers. And you especially said there are a lot of poor people, the most marginalized, are not able to access cash transfers sometimes. So I wanted to hear your thoughts on the basic income grant.
Okay, yeah, thank you for asking that. Yeah, I think what I was surprised by in my case study was the lack of access that there was, because MKUI it's not basic income, but it's kind of like that. It's meant to be a universal thing for all girl children in Bihar, and to provide for their needs in a lot of big ways, and support them to keep going to school through to completion of school. So from understanding about that, how little access there was, I think that's such a huge issue, because there's these conditional barriers meant to keep people from exploiting the system, but those same barriers actually keep out those people who are illiterate, who don't know how to fill out the correct forms and get into the system. And so then they end up paying someone else who will help them fill out the forms, and that person obviously will then take a cut or ask for money to do that. And so it becomes a real barrier. And there was one person particularly who I talked a lot with in in-depth interviews, who was very, very adamant against just mistrusting government schemes like this because of the barriers and the time costs. And so there really needs to be a lot more work around how it would be delivered in a way that actually meets those people who are really needy, in a way that's effective. Yeah.
Thank you. Do we have questions? I'm not seeing anything in the chat.
Hi, Karine. Can I ask a question? It's Helen here.
Yes, please go ahead.
Hi, Elijah. Yeah, and I can say it in person. Thanks again for a great presentation. It's interesting. There's a lot of comparative research opportunities. You mentioned you wanted to do some further work. What would be your thoughts, like looking at COVID-19 cash transfers around the world? Like look at Canada with the CERB, and similar program in the US where there were direct cash transfers, and the evaluation results to date show that they haven't always gone to support or reduce vulnerability within households. So I was just wondering if you had any thoughts on that. And I mean, I'm pushing around COVID-19 primarily because we're in the situation, and there's obviously a lot of policy questions right now around further investment in cash transfer programs everywhere in the world. So just any thoughts of, maybe directions you take it for further research? Thanks.
Yeah, thank you, Dr. Helen, for asking that. Yeah, in the COVID-19, I think that evaluation needs to happen, and that's those are kind of big scale research projects that need to happen and should happen to evaluate where is that money actually going and what is it actually achieving for people, and how is it helping out those who are actually needy. But kind of again, for me, what this case study highlights is the importance of the local community and community groups like the Village Child Protection Committee and like the self-help groups, and how valuable those were for actually helping people advance themselves and build their own capacity up in the face of crises, in the face of big needs. to have that local community that responds really quickly to their needs. And I think if I was going to keep going in this research, I would really want to be looking at how, looking at COVID, if I was to be looking at COVID-19, to be looking at how community groups actually influence the well-being of people during COVID-19. And I'd really like to explore that further. Yeah.
So I have something here in the chat. Sharada is asking, there are others who are opposed to any form of cash and favor in-kind support, providing good quality education, healthcare, and food. People like Jean-Dres champion this strategy. Cash is no substitute for actual public welfare that governments should provide. Your thoughts on that?
Yeah, I would absolutely agree with that. Not that I wouldn't agree that no cash should ever be given, but I would absolutely agree that it's not a substitute for good education and healthcare, particularly good education and healthcare. So in Bihar, they've been really successful at getting children into school recently because they're providing free meals and different incentives, but because still there's a really poor quality of education. So that's definitely what I saw in the case study. So there was a question of, is this actually useful in any way? Why wouldn't we send our children, as they're getting older, away to work rather than do this, which seems so useful and they're not learning anything. So I absolutely agree that the quality of those things is really important and needs to be there. On the issue of food and the PDS system, from the reading that I've done, just knowing the food issue and how much corruption there is and leakage there is in the PDS system, I don't know if I would agree on going against cash for that and sticking to the food system. But that's a very, very complicated issue, so I won't get too far into that.
Thank you. I'm going to refresh the chat. Do we have questions? Well, I can, if that's okay, ask the second part of my question. I do research in a place called Ladakh in North India, and the people who are building roads are in the region, people who are migrating from Bihar. And then you will see people from Bihar like doing all of the very difficult infrastructural work in the region in a very, very difficult place. And then it's very difficult to see sometimes the poor work conditions for the people. So I was wondering, it's more about like, maybe we can even say curiosity, but from like a perception of someone doing research in Ladakh, we always think that like Ladakh is the place where so many people from Bihar are migrating for work. But what are is it only my understanding, like doing research there, and what are the other places where Biharis are finding work in India?
The main areas that I encountered, actually Ladakh was not mentioned. Mainly they would go for harvesting in Punjab and Haryana, and then as well for a variety of labor jobs in UP and in Delhi. And it seemed like there was just starting to be a few more who were going south in India and finding a bit higher quality jobs in the south. But mainly that kind of regular, the high in-debt migration was to farms in Punjab and Haryana for harvesting.
Thank you.
Mm-hmm. That's really interesting that there's a lot of Biharis up in Ladakh as well.
Yes, it's really, it has been like that like for many, many years. Yeah, it's not something new. So yeah, it's interesting to hear about this from another perspective. Sharada has a question here related to data collection. So you had more male respondents and female respondents. Usually it's women on topic related to children. Is it because of a male researcher did you find difference in responses between women and men? Sharada, thank you, because I really had this on my notes here. That was my other question that I wanted to ask. So yeah, I'm really curious about that as well.
Yeah, this is a good question, and I think it would have been different if I could have put together a team with females who would be collecting data for engaging with the women. So I think as part of that, having the male researcher, but also it was because the women, because it was a lot of the questions were about the use of finances, women would disqualify themselves and say, well, I don't, even though that's not really true. I mean, they do manage a lot of the finances, but they would feel like they can't say that they do. And so they would say, well, you know, my husband will talk about the finance stuff. So I think both directions, it would have been really helpful, I think, to have a female researcher who could engage deeper in those conversations with women.
Thank you for this. I have a question here coming from the chat. Thank you for your presentation, Elijah. My name is Chantal, a PhD candidate at the University of Massachusetts, Boston. I just got back from doing my fieldwork in Mumbai and Navi Mumbai on the human security of women construction workers. I would love if you could talk more about barriers to the variety of government schemes you talked about. I found that the design of the Building and Other Construction Workers Act, for example, led to extremely poor implementation.
Oh, that's really interesting. Yeah, so in terms of barriers to cash transfers like MKUI, the main ones were the lack of literacy, and it's a complicated process to apply, and also knowledge about the program and having that knowledge at the time when the child is born, because it's a kind of program where you kind of have to get onto the tracks early with the child, and by having your child born at a health facility and getting the right immunizations right away from the beginning. And if you don't meet those conditions, then you can't get back on the tracks for MKUI. And I think that's really a faulty design, because there's so many people then who get excluded because something was missed. And there should be mechanisms there and effective work happening there to bring people back onto the tracks and to be able to participate in this program. And that didn't seem like that was happening or available at all. And so with that context, there's no one helping illiterate people get their children onto this system and involved and getting meeting the conditions and getting the resources that it provides. And so I think that's a huge flaw that definitely needs to be addressed.
Thank you. I see things moving here on the chat. I will wait a bit if people are typing. Nothing is coming. I have another question. I will ask if I may. So you have you did a wonderful project here, Elijah, and it's, I mean, you have like really interesting finding. I mean, what is next for you in terms of work? Like, are you still are you still thinking about doing studies? Do you still want to work on this topic?
Yeah, there's a lot of work that definitely could be done on this topic, but actually chose to step away from it and leave it. And I'm actually going forward to be working. I really have a desire to be on the ground and be working with local people and learning in that kind of a context. And so at least for the next little while, I'm heading towards working in actually in Chad in Africa with a local organization and working in community health and agriculture there. So I'm not really sure what it looks like yet, but that's what I'm working towards. So that's kind of where I'm at with that. Yeah.
Interesting. Thank you for that.
Thanks for asking.
Mhm. I will refresh the chat here. Do we have more questions for Elijah? Things are moving a bit. I will wait for maybe 2 minutes to see if maybe some people are typing in the chat. So for how long was your fieldwork, Elijah, in India?
So I carried it out over about 3 months in the summer of 2019. So, yeah, so I went in June and then came back in August. So, yeah.
Good timing. It's very difficult for MA students doing research during COVID that many had to redesign their research project.
Yeah, I'm really glad I was able to go before that happened.
Yeah. So I see nothing coming. Does this mean we should perhaps wrap up? Is there anything that you feel you would like to add, Elijah, based on the questions that you have? Oh, I have something here. Just a second. I'm gonna ask to unmute. We have Karine Bates here asking a question.
Oh.
Ask to unmute. Is it coming?
She going to
Just
ask?
as a, oh, is it working?
Oh.
I'm clicking ask to unmute, but it's not working. It's written muting, mute. Maybe Shirley if Shirley is there, could you help us with that?
I don't know, did Karine Bates have a question?
Yeah, Karine is unmuted, so she should.
Okay.
Okay, Karine, you're unmuted. If no question, just congratulations. Okay, it was a wave. Sorry, I'm still decoding the Zoom different like icons. There's so many things that I need to learn with the technology these days. Thank you, Karine.
Yeah.
Yeah, and then by the way, Karine is here. Karine was my PhD supervisor, and she's with us today. So it's nice to have you here, Karine. Okay, so do we have questions? Otherwise, we will wrap it up. So, well, thank you so much, Elijah, for this fascinating talk. And then you had like many questions. And thank you, everyone, for being here today. I want to say thank you to Sharada, Shirley, and Janice for being here and helping us with the technology today. I would like to invite people to sign up to the Circle email list by sending an email to, and I'm saying I will, the email address here is India Research, and it's like it within one word, and then we have dash capital L at uguelph.ca, and then you have nice messages at Elijah in the chat. It was really nice to have everybody here for today, and on this, I think I will ask Shirley, how do we close the discussion from now?
I think if you're ready to close, we just all leave the meeting and I can shut the meeting off right now.
Okay.
Yeah, thank you very much. Really appreciate
Thanks, Elijah.
it.
Thanks, Karine.
Yeah, thank you, and congratulations.
Thank you.